Today is day 3 of my treatment here in Hawaii. Now we're about to head off to Tripler Hospital for another appointment, and I'm leaving early so that I'm not late and I can figure out exactly where I'm going this time. So wish me luck. Let's go. Good, beautiful people, it's your boy Khalifa Saad, and I'm back with another video. And as I said in the intro, today is day 3 of my treatment and on my journey to kick cancer's ass. I had a few hiccups yesterday, or one major hiccup yesterday. Hopefully we've gotten that taken care of. When I tell you guys Dr. Anderson is heaven sent, this lady worked out a deal with the team in nuclear, over at the nuclear side, for me to get the CT scan. So the plan is for me to get my CT scan or my CAT scan done on Monday. Now I have a procedure that's going to take place on Monday. We'll discuss that later, but it's like a pre-surgery that she wants to do, and basically look around inside so she can see for herself what Dr. McDonald saw when he did his biopsy. So we're going to do that on Monday, and as soon as we're done with that, we're going to go down and get our CAT scan done, or PET scan done. So I lucked out. Had she not been so diligent and effective, it wouldn't have derailed my treatment. We just wouldn't have been going that extra mile like she wanted. But yeah, she reached out to the team there, and she was able to work out a plan for me to get in and get my CAT scan done. So I'm very grateful to her. But we have an appointment this morning. Like I said, I'm not exactly sure where I'm going. I know all the appointments are relatively close in proximity. As far as offices are concerned, they're all in the same building, which makes it a little bit easier. And the people at Tripler are so helpful that, you know, they'll point out where you need to go. In a couple cases, I've been taken to offices where I needed to go. So I can't express enough how well my treatment is going thus far. But once we get to Tripler, I will cut you guys back on, and I got to figure out what we're doing first. I got my paper, it says it, but I can't explain half this. So when I get a good grasp on what the next course of action is, I will let you all know, and we'll proceed from there. So I'll catch you guys in a minute. Well, ladies and gentlemen, I was gonna wait for the shuttle, but instead of waiting for the shuttle, I'm just gonna go ahead and take a taxi, because the shuttle will put us there right at about the time that we need to be there for our appointment. Good morning. Can you take me to Tripler, please? So yeah, apparently the shuttle comes at 9:30. and it takes about 10 to 15 minutes to get to Tripler from here. And what I don't want to do is be running, trying to figure out where I'm supposed to be. So I want to get there a little bit early, figure out where we're going, and move from there, because running around like a chick on my head cut off right now, I just don't feel like doing it. Alright, ladies and gentlemen, we are here. And like I said, I wanted to get here early because I don't know exactly where I'm going. This hospital is so freaking big that it's confusing. So we're gonna go in here, figure out exactly where we're supposed to be, and once I figure out exactly where I'm supposed to be, I will cut you guys back on and update you on exactly what we're doing. Wish me luck and whisper a prayer. Alright, so I just checked radiology and the appointment's not there. Like I said, this hospital is laid out. One, is large as fuck, and two, is laid out weird. So we gotta go to I think it's ground floor D wing, is what she said. So this is so freaking confusing. I tell you, they don't make it easy. You know, when I tell you guys this fucking hospital's confusing, the layout is terrible. I'm gonna run around for almost 10 minutes trying to figure out how to get to one wing, because the maps really don't map it out properly. I'm damn near late for my appointment because of that. But that's why I got here early. Because if I got here on time, it'd have been a wrap. Alright, so we finally figured out where we needed to be. So now let's go in here to our appointment. Alright, so here we are. She's going to find out from the doctor. I know you guys didn't see her because she was off camera. We're going to find out from the doctor if it's going to be okay for me to record while we have this conversation on what's next. Hopefully he doesn't mind, but if he does mind, I'll update you guys once we finish with the appointment. But when I tell you it was so hard and confusing trying to get here, that's an understatement. The building's laid out in two wings with I think it's two or three levels, or 4 levels per wing. But it's just not mapped out very well. And a lot of places don't know it. They don't know what each department is. So anyway, he should be here shortly. I'm sweating like in church. If you know what that statement means, you know. But yeah, I've been running around like a chicken with my head cut off.
Sorry.
Alright, no problem.
In case you were bored, I brought some journals for you.
That's who I had to ask if I could vlog this.
Thank you very
You're
much.
welcome.
She's gonna find out from the doctor if I can
That was
actually
so sweet of you.
record or not.
Yeah, it was a nice gesture.
Oh man. Alright, so now that the check-in process is done, she's going to speak with the doctor and see if he's ready. They're going to conduct an examination, and this is to basically lay out my options and determine whether or not any follow-along treatment will be required after the surgery. And this is just kind of lining everything up. Now, they're not going to know for sure until after the surgery has been conducted. But, yeah, this is basically the oncology. Yeah. Hopefully I don't have to get either. Between this and the appointment that I missed yesterday that's been rescheduled, it will determine what the source of treatment is after the fact. Now, if I don't have to get radiation or chemo, that would be great. But if I do, then it is what it is, and I'll deal with it at the time. But let's just wait and see what the doctor has to say, and then we will see what the PET scan says next week, and that will determine the next course of action. So, all right, it's time to move over to the doctor's office and see what he has to say. They're going to do an examination, look inside to see what they see, and we will go from there.
All right, sir. So you can have whatever chair looks most comfortable.
All right.
Hello, good to see you again.
Good to see you as well.
Yeah, yeah.
And thank you for allowing me to document this for my family.
Yeah. Well, I just didn't know what, there's all kinds of regulations people have at the hospital. I'm not aware, and you've been doing it the whole time.
Yes, I've been doing it the whole time.
Yeah. So I know you've met with Dr. Anderson and Dr. Nguyen, right?
Yes, sir.
And they kind of went over multiple things with you, like the chemo part and the surgery part. I know you have your PET scan scheduled for Monday.
Monday, yes.
And then when's your going under anesthesia and then kind of them looking at things?
Monday, Dr. Anderson is going to put me under and kind of look.
Does she know you have a PET scan the same day?
Yes, as she scheduled it.
Okay, she scheduled the PET. Okay.
So she's going to go and take a look, see how it looks inside. But the actual surgery itself is not scheduled until Wednesday.
Okay.
For the removal.
Okay. And then she's going to make that determination based on what she finds during the exam, right? Okay. So what I was seeing in the chart, so you're from, you live in Guam.
Yes.
You got some occupational health to get a duty station or not a duty station, but a GS job or something.
Yes.
I was reading through the charts.
I'm supposed to be transferring.
And you were supposed to be there this month.
Actually, on the 20th, I was supposed to.
Okay. And so when you were getting seen for that, I saw very shortly afterwards you got seen by your PCM for the tonsil issue.
Yes.
Was the occupational health had nothing to do with that? It's not like they found something and said go see your PCM.
No,
it was you that.
It was me that noticed it. So as I was explaining earlier, I used to suffer. Well, I had tonsil stones before.
Okay.
So when it first it presented itself like a tonsil stone.
Okay.
So I was going to do the same thing. I was just going to take my water pick, spray it out, and be done with it.
Yeah,
but when I looked in the back, my tonsil looked a little off to me.
Yeah, okay.
It looked inflamed. So I made an appointment to go get checked.
Okay.
When I went to go get checked, my PCN looked, and he was like, well, something doesn't look right. Let me call over to ENT.
He gave you the look.
Yeah.
Yeah.
He was like, let me call ENT and see if we can get you scheduled for an appointment.
Yeah.
So he took a picture of it, sent it over, and ENT said, get him over here right now.
Okay. So so I kind of know everything else. I just want to get that perspective from your side. So I know you were seen by him. You got the CT scan. It showed this lesion. You got the biopsy. The biopsy came back as and talk to me about how long you've used. I just saw that you've smoked in the past. How long? And
I smoked for probably a little over 20 years.
Okay, like a pack a day.
Pack and a half a day. I used to drink a lot too. I'm a retired CB.
It happens. It happens. 20-year pack. Okay. Okay. And then so CT scan was done, and then you had the nasopharyngeal laryngoscopy on the same date of the CT scan. So everything got done very, very quickly. I kind of read the his description of the mass when they did that. Read the operative report that you had on the 24th, because they did like a direct visualization too. They put you to sleep.
Yes.
Which is something very similar they're going to do on Monday.
Right.
Right. Okay. And then the biopsy was done that time. And now you're still. So the reason you got seen is because you thought it was I
thought I was just having tonsil stones.
And because it was painful, or because things were getting stuck there?
Because food was getting stuck.
Okay. And it was like difficult to eat and swallow. And you're still experiencing that?
Yes.
Okay. And it's more just solid food?
It's more solid food,
okay.
Yes.
That thing is like beeping. I don't know if the battery...
Yeah, no. It's beeping on the back. It's just saying it's recording.
Okay. Okay, so that... And no weight loss?
No weight loss. No other symptoms whatsoever.
Okay, no taste changes, nothing like that. No ear pain or anything like that. Okay. So, okay. Anything else about... I know you've had like some heart issues.
Mm-hmm.
Okay. Anything else I need to know about like medical history or...
No.
Okay.
The last time they checked it. But no, I mean, I'm just on preventative medications because of the heart attack. But
okay.
I've never had like high blood pressure or anything.
And no pacemaker or anything like that?
No pacemaker,
and you've never had... Okay. You never had radiation therapy before?
No.
Okay. And no headaches, blurred vision, hearing issues, besides difficulty eating solid foods, no like random muscle aches, chest pain, shortness of breath, coughing up blood, nothing like that?
No, I do hack up blood every now and then, but I think it's because of the tumor.
Okay. And as far as like muscle cramps, pains, anything out of the ordinary?
No.
Diarrhea, constipation, anything out of the ordinary? Blood in the stool?
No.
Okay. So now I'm going to kind of go into the just kind of the cancer perspective. So there's two major things that we're missing right now in my mind is the PET scan, which is super important. And the PET scan is essentially going to tell us like if
what's been affected,
kind of the tumor, right? And then anything that it may have spread to, like your lymph nodes in your neck. That's the most common place where they kind of spread to, okay?
Yes.
So that's what the PET scan is very, very important for us, or to make sure it hasn't spread anywhere else, right? The other very important thing is going to be the surgeon going in there and kind of visualizing this and see where it is, if it invades any structures in there, how confident they are they can take everything out with what we call clear margins, okay? Mm-hmm. So that's the idea of the thing on Monday is, does that person, I want to say Kelly, but you probably don't know her as Kelly, Anderson.
Yes.
Yeah. If Dr. Anderson thinks she can do everything surgically very, very well, and it's not going to cause you any huge deficits as far as like eating and swallowing and things like that. So that's going to be her determination on Monday, okay? So those are the two things that I kind of really need to know before I can make any like, this is what I recommend, this is what I don't recommend. I could tell you that, I don't know if you read all your reports, do you?
I'll read most of them.
Okay.
Yes.
So when and this isn't, this is probably why a lot of physicians don't like to be videoed.
I can stop if you need me to.
Yeah, if you don't mind.
All right.
Okay. So, like we talked about, if Dr. Anderson doesn't think you're a good surgical candidate based on the factors that we just looked at, and so that's why I would want to treat you with chemoradiation therapy if you weren't a good surgical candidate.
Okay.
We did discuss like if you were a surgical candidate, there's factors that may lead you to need radiation therapy, the adverse factors, and then even worse factors like positive margins or extracapsular extension that may need you to have radiation and the chemotherapy, okay? So now we're going to talk about just if you're just not a surgical candidate and we have to move forward with the chemoradiation therapy, okay? Typically, we would discuss your case. Once again, we would go over the PET scan. We'd go over the exam under anesthesia with Dr. Anderson and make some final decision. But I'm just going to kind of talk because I think it's better with the chemo radiation therapy just based on that size of the tumor and what I'm measuring. So we talked about Dr. Nguyen talking to you about the cisplatin, the issues of getting an audiology test because it does affect your hearing. Once that's kind of done, we like to get you set up with nutrition and speech and swallow and kind of get you on the baseline. There's some practices or there's some places where they put a PEG tube in patients.
That, yes.
I typically don't do that. I've had a very good time managing patients through without getting the PEG tube. And throughout the treatment, we want you to continue to try eat and drink as much as possible and not use the PEG tube. But I typically don't recommend it. So how does everything get done? So the first thing we need to do is essentially in another visit, you would come back after you get all your procedures done, and essentially you would sign a consent form saying it's okay to move forward. Typically, have you seen a dentist here?
No, actually, I have an appointment scheduled next week.
Okay, and who's that with? Is that here or?
It's here.
Okay. And do you have a history of bad issues, like dental issues or anything else?
Okay.
Okay.
Get together my teeth.
That's okay.
As a matter of fact.
It's usually like with our oral maxillofacial OMFS team.
Dental visit on the 18th. Yes, I have a dental visit on the 18th.
Can I see it real quick? This one. Oh, OMS. Okay. Okay. So great. Okay. So, and the reason we typically want, because if any teeth are kind of borderline or they don't look good, we like to have them removed before we do the radiation therapy. And typically, sometimes what they do is they extract them if they need to be extracted, like during when you're under anesthesia, and they'll just have you sign another thing. But if you usually, if your teeth are good and you see the dentist regularly, it's probably not going to be an issue, but we kind of want them to verify that. So after that's done, come back here, we would do something called, or you would sign a consent form, and then we would do something called a planning scan or a CT simulation. The CT simulation is essentially you lying flat. There's a plastic little mesh with a whole bunch of little holes on it. We warm it up a little bit and we put this over your face. It's got a whole bunch of little holes in it, and this becomes your personalized mask that you would wear with the treatment. That whole process of the CT simulation takes about 45 minutes to an hour. Once they make the mask and everything's kind of conform to you, you go in a CT scan and then you come out, okay? And then typically you would go home, and then me and my team would come up with a radiation plan. That takes about anywhere from 10 to 14 business days, so about 2 weeks. During that time, I'm taking that CT scan, I'm taking the PET scan, I'm fusing that, and I'm essentially telling a very sophisticated computer system where I want the radiation therapy to go and where I don't want it to go, okay? And that's why it kind of takes so long. And then we have a physics, we have dosimetry. Actually, we don't have dosimetry here, so that's why we've been referring patients out. So even though I'm talking all of this, you're going to get treated here, most likely you would get treated elsewhere. I know Guam does have radiation there. So when I start talking about the logistics and the weeks long that kind of takes, you'll kind of know it's probably better to get treated where you have more assets. Okay. The CT simulation. Once that gets done and the plan is finalized, you would come back and then get your essentially get your radiation treatment, and then that's when it would kind of start. Most clinics have specialized parking where you come in, get your treatment. The treatment, that whole process takes about 15 to 25 minutes. What I would envision for you, like most places, it would be 35 sessions. So 35 times you would have to come to the clinic, Monday through Friday, every day. You're off on Saturday and Sunday, but essentially 35 sessions.
Okay.
Okay. So it is a huge time commitment. Okay. And then that would be intertwined with the chemotherapy. Every clinic does a little bit different. Like I think here they do it usually on Monday. So you would, the first day you start, you would get the chemo on Monday and then come get your radiation treatment. Okay. And that would be kind of the logistics. Usually one of the docs sees you once a week to make sure everything is going okay, but there's usually always a nurse or somebody there that if you have questions or concerns, somebody can kind of address them.
Okay.
Any questions about the logistics? I'm going to kind of go into the side effects.
Not right now, no.
Okay. So the side effects of the radiation. So every day you come in for your treatment, you're going to be lying in the same position as a CT simulation, except you're in a big room. They usually shut a door behind them. And then there's a big machine that kind of rotates all the way around you. That's most of the machines. I think even at Guam, they have this similar machine to what we have here. There's one or two machines that are just like a donut that you kind of go in. But I think I've looked up Guam, and I think all of theirs is kind of like what we have here, like a TrueBeam or a Varian product, okay? So you'd be lying flat, the mask is on your face, the big machine goes all the way around you, it should never touch you. The radiation or the x-rays, you can't see it, hear it, smell it, taste it. When you leave, you're not radioactive, you're not going to turn green into the Incredible Hulk or anything like that. The effects of the radiation are cumulative, so you're typically not going to feel anything the first day, the second day, the third day. But going on to like the second week, the third week, that's when, these symptoms are starting to kind of come up. Some of the symptoms you may notice is some redness kind of in the area that we're treating, like your neck. Depending on the PET scan and a lot of other things, we may be treating both sides of the neck. That's typically what I do, especially in your clinical scenario. So this area, you may start noticing it getting red all the way down here.
Like sunburn?
Kind of like a sunburn. So typically what I tell patients is like, I don't sugarcoat anything. Like this is the toughest treatment that we deliver in radiation care. I would say this and like anal cancer, they're very sensitive areas, if you can imagine. So this is a very, very tough treatment. And I've gotten lots of patients through it. And the way we get through it is we use medications. One of the biggest medications I use is something called gabapentin that I would highly recommend for you to mention if you get seen in Guam for it. I typically do it like the day you start radiation therapy. I start a little taper. I can give you some documents and you can give it to them. But this is something that has been like a game changer to me that I give all patients, okay? Because the treatments are very, very harsh, okay? So like I said, what's going on in the outside is going on in the inside. So how does that kind of elicit? Like ulcers in your mouth, okay? We start taking away some of your taste. So things don't taste good. I've heard everything from it tastes like garbage to I can't taste anything, okay? And then it's also painful as you eat and swallow, like your esophagus. We're getting some of your esophagus in the back of your tongue. And then on top of that, what happens with your parotid glands is at first you get like ropey, thick secretions where it's just like, some people even want like a suction to suction all that out. But some people just kind of like spit it out into like a little canister or something, a little Gatorade bottle. Some people describe it as like the worst sore throat that they've had, okay? And remember, this goes on for multiple weeks. What I usually tell patients, it's the time you finish, it's 2 weeks before that, and then 2 weeks after that are very, very bad. And then things after that, 2 weeks after the radiation, things start getting a little bit better progressively. And the other thing we're going to talk about is like your beard. If you like to keep your beard, that's fine. What I usually tell patients, just don't change. However we do that CT simulation, we want you to be the same throughout the whole treatment.
Yeah, I want to keep my beard.
Okay. You may lose some of it, especially like kind of in this area where we're targeting some of those lymph nodes. And usually I tell patients it will most likely grow back. I definitely have seen patients where it does not grow back. The biggest things that I tell patients is let me know when you start developing pain, so I can increase that gabapentin. Don't tell me, if I see you on Monday, right? Typically patients get seen once a week. If I see you on Monday and Thursday, your pain went from, 3 out of 10 to like 7 out of 10, don't wait until the next Monday to say, hey, I'm starting to get some severe pain. Because it's always better to be ahead of the pain. Okay.
Yes.
We're not going to completely take away your pain, but the thing is to keep it manageable where you're still able to eat and eat and eat.
Okay.
Okay. So number one, make sure we stay ahead of your pain. Like I said, I highlighted the side effects. I just want to say, like, I didn't mention every single one. Like, you know, your beard may be gone. You may get, you know, like, there's all kinds of things that can happen. That's what the consent form is for. But those are the highlights that I kind of wanted to talk about.
Well, ladies and gentlemen, we have finished our appointment. And once I get settled, I will sit down with you guys and break all of this stuff down, what exactly the doctor was referring to, and what the next course of action is. But first, I need to figure out how the hell to get out of here, because I have no idea where I am right now. This hospital's confusing. It's so big. Well, ladies and gentlemen, we made it out of the maze that is Tripler Hospital. When I tell you all, that place is confusing to get around. It is extremely confusing to get around. But I'm going to have to sit down and actually go back and review the conversation that just took place, because there was a wealth of information in that conversation that I want to make sure that I highlight. And I also want to make sure I have a complete understanding, and forgive the noise that's going on behind me, but make sure I have a complete understanding of what was being said so that I can break it down in this video. Now, just keep in mind that the conversation we just had with the doc has been shortened, because if I were to upload the entire conversation, this video will probably be about 2 hours long, because I was sitting in his office for about that, between conversing with him and getting an I was about to say an inspection, but having him do an observation and look at what he can see as far as a tumor. That took a little while. So I dissected this video up so that you guys aren't sitting here for a whole 2 hours. But I left in all of the pertinent information and stuff that I want to share with you all. But right now we're just waiting on our chariot to arrive, and it is here. We're going to head back to the hotel, regroup, and figure out what we're going to get into after this. I always hand them my retirement ID. Let me give them my VA ID to make it easier.
So where you going?
To the hotel.
Hotel? The next one's at 13 minutes. I'm not the shuttle today.
Oh, you're not? Oh, you're not going back to Honolulu Hotel? Oh, okay. All right, no problem.
Take care, God bless.
All right, thank you. Okay, well, I guess that's the wrong shuttle, which makes no sense. It says Veterans Transportation. Well, I guess they got multiple shuttles. So we'll just sit here and wait on the other shuttle that's going to take us back to the hotel. But as I was saying, I left in the pertinent information and the stuff that I wanted to actually share with you all, so that you are aware of what's going on with my treatment and the direction we're going. And for those of you out there who do pray, for you to know exactly what you're praying for, so you can direct those prayers with the correct energy. But yeah, now we're gonna sit here and wait for the shuttle to come and take us back to the hotel, and then we'll figure out what to do from there. But to keep this video from being too long, I'm gonna go ahead and end it. So this has been your boy Khalifa Saad. Check it out with another video. Make sure you like, share, comment, subscribe, click the post notification bell, turn it to all, so that you know when I drop a new video, and whisper a prayer for your boy. And with that, I'm out.
We ready? Who ready? We ready? Who ready? Who? We ready? Who?